Hi, welcome back. My name is Sheldon McLeod, and this is Thinking Out Loud, presented to you here on the SaltWire Network. Again, thank you for watching, listening, and commenting. I certainly do appreciate that. There's a negotiation underway right now in Ottawa between the provinces and the territories, or at least their leaders, and the Prime Minister and the Government of Canada. It's about healthcare funding. The provinces are looking for about 35% of costs to be covered. In total, that could be as much as $28 billion. And they're looking to have this negotiated over the next few days. It's a talk about or discussion about strings. Do we need to have strings attached? Should it be just money handed over? Federal infrastructure or federal money for healthcare does not really cover infrastructure. And that's one of the big challenges we have in our province right now. And I was on the receiving end of a news release from the Nova Scotia Government Employees Union early this morning, saying that on January 23rd, the nurses working at the Halifax Infirmary Emergency Department wrote a letter to the Premier, the Minister of Health, and the CEO of the Nova Scotia Health, expressing their deep distress following the government's failure to address what they call the retention crisis in our emergency department. And to talk a bit about this with us, what the letter says and what actions are hoped for, he is the first Vice President of NSGEU, Mr. Hugh Gillis. Really nice to see you. Thank you very much for joining me.
Thank you for the invitation.
When nurses get together and say, listen, this isn't good, we're not in a good place, we need help, what does that tell you about the state of healthcare and the stresses on the workers right now, Hugh?
Well, it's very telling. This isn't the union speaking. This is frontline healthcare workers. This is our frontline nurses at the QE2 speaking out from experience. And so the issue is Nova Scotia Health has become very reliant on travel nurses and agency nurses now, and staffing levels are so low that they need them to keep our hospitals running. And the problem with the travel nurses is they're making more than double the hourly rate of our NSH nurses. And so understandably, they're very upset and being paid so little in comparison.
Right. And I had a conversation with interim president CEO Karen Oldfield a few weeks ago, and she discussed or talked about travel nursing, and we need to have a short-term vision, a medium-term goal, and a long-term view of what's happening right now. And the anecdote she shared was that she was at a public event, and someone told a story about how a travel nurse decided to show her pay stub to the other nurses who were working on that floor that day. And she said, that's not helping. There's a recognition or acknowledgement, at least, that is not a sustainable way forward. So what are these nurses asking for, bottom line here?
Well, they're looking for immediate help. I mean, the hospitals, our emergency departments, they can't be running at 50, 60% capacity with nurses. We need nurses in the emergency department working with the patients. Our nurses are very concerned with nursing-patient ratio. They're concerned with respect to their license. They can only do so much, and they've just really hit the wall.
What are you hearing? If you have a situation where the government says we've added more nursing seats, we're putting more nursing students forward, we're forgiving loans, we're giving help, we're showing support, what is that doing to morale when you have an influx or this idea that it's all about recruitment and that the people who are working in the system are not necessarily top of mind, or it might appear that way to them?
Well, to give the government some credit, they are looking at some long-term solutions. I mean, when you add more seats in a nursing program at universities and community college, that's positive. But that's significantly down the road. What our nurses at the QE2 are telling us, they need immediate action. And so we're losing too many of our nurses, too many of our experienced nurses leaving the system, becoming a travel nurse because it's a little more attractive. We need incentives for our nurses right now to remain. Emergency medicine, working in the emergency department is a very skilled, you need a skilled set to work there. And so you can't have just new nurses there. You need experienced nurses that helps mentor the newer ones as well. And so we don't have the right mix right now. And that's very, very concerning, very frustrating. Our nurses are burnt out. So we need to incentivize, we need to have more incentives to keep our nurses there and to bring back nurses who've left.
And Karen Oldfield did also tell me that they are not just doing exit interviews, but they're doing interviews with nursing on the floors now saying, why are you staying? What will it take to keep you here? To me, that suggests at least there's this, again, acknowledgement that there's something wrong. Something needs to be fixed. What do you encourage her to do based on the information she may be receiving?
Yeah, sure. So like we need perhaps retention bonuses, maybe a premium for when nurses are working short, just incentives to keep our experienced nurses in the ERs right now and to bring back other nurses as well. The message that the government is sending, it's a little mixed. They're saying we're working on recruitment, we're working on retention, but at the same time, when our nurses are working side by side with a travel nurse that's making double, it's pretty demoralizing.
But how do you correct that if there's also this recognition that we desperately need people so that it doesn't collapse right now?
Well, at the end of the day, they're going to have to pay the nurses more than what they're paying them in order to retain them and to recruit new people. We're competing with nurses right across all jurisdictions. And so they're highly sought after, and you're going to have to pay them more than what they're getting right now. Obviously that's the case. I mean, the health minister has acknowledged they could hire 1,500 more nurses.
But where are they going to come from? That's the big question right now.
Exactly.
Right. It's all connected. By that, I mean, it's about work-life balance. That's clearly why some nurses are leaving the profession to go become travel nurses, or are leaving pensions behind, or leaving those kinds of benefits that would be negotiated from the perspective of their collective agreement. But yet here's this crunch, which is without having another source of staffing, we're in a bit of a pickle. I just don't know how it's got to be complicated. It's got to be complicated for the government. It's got to be complicated for the union, or is it really simple? Is it just money that will fix this?
Well, I mean, the healthcare crisis didn't happen overnight. It's not going to be solved overnight. But traveling nursing is becoming very attractive for many nurses because, it's a higher pay. There's some work-life balance there. And so Nova Scotia Health really has to address that. You can't have nurses working 5-6 days a week, 16-hour days, and expect them to continue to just give 100%.
The letter that was sent, where are the calls to action? Where do you see this idea of fixing the solution going, at least from the perspective? Government says there are no bad ideas. We're listening. We want to hear these ideas. So what are these ideas?
Well, I mean, the Premier said that, he's prepared to spend, and we just have to come up with some incentives for our nurses, our experienced nurses, to remain working in the emergency departments. And right now, the incentives are just not there. And it's a matter of the government looking at some of these recommendations, some of these suggestions, and ultimately acting on them. Long term, they're doing a lot of great things in the long term, but in the very short term, we need to keep our nurses working at the hospitals. And right now, the incentives are just not there. Everything is working against them. They're working so short-staffed. They're concerned about their license every day. It's on the line because when you work so short and when you have your work, the patient ratios so high, I mean, it's so hard to put into words what they're feeling. It's just total frustration on the nurses' part.
And if there's a fear of liability, would some sort of assurance from the government?
Absolutely. I mean, their license is on the line every day. They make a mistake, they're responsible for it. But despite, the long hours, working short, mistakes are going to happen. It's inevitable.
Is there a proposal here for changing the way shifts work, paying a premium for overnights, or giving the opportunity for staff to exclusively say, well, I will just work nights if I get a better pay? Is any of that being discussed?
Well, we're hoping that we have all those discussions. But again, night premiums, working on weekends to attract nurses to come in. There needs to be more immediate incentives. And right now, the incentives are not enough. It's as simple as that, because we're losing. It's just a revolving door of nurses leaving. So we need immediate action with respect to incentives to keep our nurses working and to bring back nurses from travel agencies and elsewhere. It needs to be more attractive. And right now, it's not attractive. We're moving in the wrong direction.
Even if you were to double the salary, it still sounds like there'd be a challenge with that work-life balance. That might not even solve the solution, might not be the solution. I'm, again, just looking at somebody from the outside, it's not just the pay. I know I've had lots of jobs where if I had a little more money, I might put up with a little more.
Yeah. I don't think Nova Scotians truly understand this whole piece on travel nursing and agency nursing. I mean, it doesn't make sense to have a private company poaching from our own, paying them double, working side by side with our nurses, literally doing the same work. That doesn't make any sense.
But to back away from that, as you say, this is an evolution. It's taken a crisis to put us here, and trying to back out of that, it's going to be a challenge for a government, for policymakers, for administrators.
There's never any easy solutions. These are tough situations we find ourselves in. But again, immediate steps as far as continuing to retain the nurses that we have, and to bring in nurses back into the emergency department, you're going to have to pay them more, because simply now the compensation is clearly not enough. I mean, we see that when the health minister says we need 1,500 nurses. I mean, that tells you all you need to know.
And the timing,
nurses in hospitals.
And the timing right now with the federal negotiations, are you hopeful our premier does bring this to the table to say we would be better served if we had more money to pay these nurses? Is that even an option?
Well, I certainly don't speak for the premier, but I'm quite confident that he will be lobbying as hard as he can for money for Nova Scotia, because it's badly needed.
And as has been acknowledged, there is a shortage of staff, and it's going to take time to graduate student nurses and to get them trained and to get them in the field. So short term, a little more money. If I'm hearing you correctly, more money will help people hold on longer.
Absolutely. Yeah. We have to stop the bleeding.
Anything else that I didn't address or bring up, Hugh Gillis?
No, the premier has just challenged all of the healthcare, groups to go like hell and just go. And so we encourage the premier, we encourage the government to really focus on retention of our nurses. And the best way, the immediate way to do that is through new incentives to keep our nurses working and to bring back other nurses who have left. And we really need the right mix of nurses in our ER. We just can't have new grads working there. They need to be mentored. They need to be supported. And right now, the mentoring and the support is not there. The new nurses are coming in, they're not supported, and they're leaving. Again, it's just a revolving door.
I know I said that was the last point, but there was a proposition a few weeks ago by Dr. George Burden suggesting that retiring physicians, GPs, be put on a salary and be given a role as a mentor to help bridge that gap between retirement and recruitment. Is that something else that might be a fix here?
I don't think there's any bad ideas, so I think we just have to look at everything, but we need immediate steps to keep our nurses. And a lot of the solutions, the long-term solutions, they're good, but we also need short-term solutions immediately. And this is the way, I believe, to keep our nurses working and to bring back nurses who have left the system.
And the urgency is received. First Vice President of NSGEU, Hugh Gillis, thank you so much for your time, sir.
Thank you.